Hello, Daryl. My name's Cadence. I'll be your nurse today. What brought you to the hospital?
Oh, my stomach hurts.
Well, that's not good. Hopefully we'll be able to get to the bottom of that. Can you state your name and date of birth for me?
Daryl Blue, 817XX.
Okay, and I don't see an allergy band. I'm just going to double check that on the MAR here quick. Okay, Daryl Blue, 817XX, and no known allergies. Perfect. Okay, we're just going to be doing a quick head-to-toe assessment this evening. Okay, so you know your name and date of birth, so could you tell me where you are and what month it is?
It's Mitchell Tech Hospital, and it's October.
Okay, perfect. And the patient's behavior is normal. Are you having any pain today?
Oh, just a little bit in my stomach.
Okay, what would you rate that on a scale of 1 to 10?
Maybe a 3.
Okay, and what's your tolerable level of pain?
Oh, I'd say a 5.
Okay, perfect. And then do you feel safe in your home?
I do.
Okay, perfect. And then you've never had the urge to self-harm or hurt somebody?
No.
Okay. I'm just gonna go ahead and start my assessment really quick. I'm gonna start off with your head and neck, and then we'll move down to your chest, stomach, your arms, legs, and then your genitalia. Sound good?
Okay, yeah.
Okay. So I'm just going to assess your face, skull, and hair for any lumps and bumps in it and the neck. And that all feels normal. And his skin is dry, warm, and looks like it's a good color. So I'm going to go ahead and start with your eyes. Could you look off into the distance for me?
Yep.
Okay, and then I'm just gonna have you follow the light. Perfect. The pupils are round and reactive. So I'm gonna go ahead and look at your nostrils. Those are looking good. Could you give me a big smile quick?
Sure.
Okay. The tongue and gums look good and they're nice and pink. Okay, I'm gonna just look at your ears now. The external ears. Okay, now I'm just going to palpate your sinuses here. Are you having any pain when I do that?
No.
Okay, perfect. Any pain here?
Nope.
Okay. I'm gonna move on to your chest. So I'm gonna expose your chest here a little. Okay, and the skin is dry, warm, and a good color. So now I'm just going to test for tuger, and the skin is nice and elastic. I'm gonna go ahead and take your apical pulse here. Okay, that sounds good. It was 80. Okay, now I'm just going to listen to your lung sounds. I'm just gonna have you take a deep breath here for me.
Okay.
That's good. Can you do that again?
Sure.
Perfect. Those are sounding good. Okay, I'm just gonna cover you up here now. And I'm just gonna pull your gown up from the bottom. Okay, now we're just gonna look at your stomach. The skin is dry, warm, and a good color. I'm first gonna listen to your bowel sounds. When was the last time you had a BM?
Just early this morning.
Okay, perfect. Okay, those are sounding good. I'm gonna go ahead and just feel around. Okay, that is feeling great. I'm gonna go ahead and move to your upper extremities. I'm just gonna try and get you covered up here quick a little. Okay, I'm gonna first assess your strength. Can you go ahead and squeeze my hands for me?
Yep.
Perfect. Those are equal in strength. I'm gonna now go ahead and feel your radial pulse. Perfect, that is very normal. Okay, and his skin is warm, dry, and intact, and a good color. I'm gonna go ahead and move on to your legs or your feet here. And I'm just gonna pull up from the bottom of the bed so I don't have to uncover you completely. Okay. Can you go ahead and push my hands back for me?
Yep.
Perfect. And then pull them forward.
Yep.
Good. And I'm just going to check his capillary reflex. Good. That was less than 3 seconds. And that was also less than 3 seconds. And then the pulse I would find right there and right here for his feet. And I don't see any edema on your lower or upper extremities, so that's good. I'm just gonna get you covered up here again. Okay, and I am going to check your capillary reflexes in your hands here. Good, that was less than 3 seconds. And that was also less than 3 seconds. Okay, we're now going to start with the assessment of your perineal area. So I'm gonna go ahead and throw some gloves on before we start. Have you been having any pain in that area lately?
No, not really.
Okay. So I see you have a catheter. Okay, I'm just gonna lift up your legs and check the folds. I don't see any redness there. I don't see any redness on this side either. And everything looks dry. And I don't see redness, and there's no drainage. Okay, so now I'm going to have you roll over and grab this side of the bed rail for me. Okay, so I am just going to check, and everything looks good down here, and you haven't been having any pain in your back or bottom area?
Nope.
Okay, I'm gonna have you roll back. Perfect. Okay, and I also forgot to ask you when I was assessing your head, but do you have any trouble hearing?
No.
Okay, perfect. So that all sounds good. Okay, I'm gonna go ahead and document this outside of the room and then let you get some rest. Okay, your bed is in a safe position, but I am gonna lower it because it is a little high. Are you comfortable the way you're sitting right now?
Yeah, I'm good.
Okay. Okay, and then your call line is located right next to you if you need anything from us. But otherwise than that, sounds good.
Okay, thank you.